where do we see a lot of your patients, or where do you see where arthritis is most painful? Elbow?
I would say the most common presenting joints in our clinic are knees, hips, and shoulders.
Knees, hips, and shoulders.
Correct, yes, but this can affect any joint in the body. Any joint in the body can be affected.
All right, we have a 3D image of, I believe, the knee, and this
Correct.
is a serious knee arthritis. Why don't we take that real quick, and doctor, tell us what we're seeing here. And, oh, that looks painful.
What we're seeing here is a knee joint, so the area that you have where the bones meet, that's actually where the cartilage is. And let me see if I can edit the image here a little bit to show you where you would see some of that wear and tear, and it's exactly in this area right here, where I'm drawing that arrow, where you start to see some cartilage breakdown. So as the cartilage breaks down, you start seeing the bone under it get exposed, and that's what triggers, or what is believed to trigger, that inflammatory response and changes the environment inside the joint. It's important to remember this joint is also covered by a capsule, and that capsule contains or retains the joint fluid, or what we call the synovial fluid. So inflammatory markers in that synovial fluid are usually altered or increased for some of them as well when you have arthritis. So it's not just about wear and tear, it's also about an inflammatory environment inside that joint.
I tend to like to label through 1 through 10 how bad this is, 10 being the worst. What is this?
Well, I would say, because there's more than one area affected here, you could perhaps say maybe a 6 or a 7, right? But there's other factors to consider, just not the wear and tear in the cartilage, but also the development of osteophytes, or what people know as bone spurs, and the amount of narrowing in that joint compartment, which all of that factors into the classification system for the severity of the disease.